Welcome to LocalLink Hub's podcast. We are a show with local impact for global change. LocalLink Hub is the localization and partnership initiative for Terre des Hommes. We are a global online platform and we provide free e-learning and capacity development resources for local and national NGOs. Our project is funded by the Somaha Foundation. My name is Majko. I am the Content and Communication Manager for LocalLink Hub. And thank you for listening to today's episode with the title, Moving Children from Institutions Back to Families. Let's get started. On today's LocalLink Hub podcast, I'm joined by Majko, Executive Director of Nisma Arsis from Albania. I had the opportunity to meet her in person in Budapest, where she was joining a new regional project kickoff. She has over 13 years of experience in child protection and specializes in addressing issues like child trafficking, abuse, and exploitation. She has authored several publications, contributed to child protection training modules, and conducted research focusing on at-risk children. In today's episode, we talk about Nisma Arsis and the work the organization does in Albania, protecting vulnerable children. We learn about Nisma Arsis' journey from focusing on street children to providing a wide range of services, including community centers, emergency shelters, and family support programs. We touch on the delicate issue of human trafficking. Anna explains her new regional mental health project and their successful efforts to move children from institutions back to family care. Hi Anna, welcome to our podcast. You are the Executive Director of Nisma Arsis since 2016, and this is practically since the foundation was established. And as a psychology student, you could have many more other opportunities and other choices than a foundation. Why Nisma Arsis? Why the nonprofit sector?
Thank you for the invitation in this podcast. I'm emotionally happy to be part and to share my experience and how I engaged in the civil society sector. I have studied psychology and I took my degree in 2010, and after that immediately I started working as a psychologist in an organization, so a civil society organization, supporting children in need of protection. And here where it started my passion and my engagement with the vulnerable groups like children, especially those children in difficult situation, in street situation, in need of protection, victims of abuse, trafficking. And this is the point where I understood that I can be a psychologist, but I can be much more. Because psychologically I treated the individual, but much more means engaging more in policy level, advocacy, awareness, giving more to the community for the prevention of these phenomena. So this is where my heart goes beyond to counseling and clinical approach. And I studied later on my master's degree, organizational psychology. So I try to relate my background in psychology on development in the organizational field. So this is how I match my academic background with my field work. I studied in Arsis, working in 2013 as a social animator. Social animator, working and implementing the AMDAC methodology, so trying to work with children and trying to support their emotional well-being. And later on, step by step, I tried to engage more and more and to grow up in that field. So from Arsis branch of Arsis in Greece, we transformed ourselves in a local NGO. This is why we put this nickname Nisma Arsis, but it was the same organization with the same mission, tradition, and values. We just locally separated from a branch to a local organization. And this was where the board members of the organization decided that from a coordinator in the field, working with vulnerable groups, trying to be an executive, so managing and trying to develop the organization for reaching more beneficiaries and being more present in the community as a grassroots organization entitled.
Okay. You are a really long-time partner of TDH in Albania, and both organizations, as we know, work in child protection, and this can be considered a natural match, but how this partnership started, can you tell me?
I can proudly say that what I've heard about his history, it is a whole history behind that. Even though I've been not present in that time, but still I'm informed and aware of how Director of Nisma Arsis in Greece decided to support children victims of trafficking in 2005 with a project, very big project, transnational project between two countries, because there were at that time Albanian children identified as victims of trafficking in Greece. So both organizations wanted to have local presence in Tirana, in Albania, in order to match with the institutions, to identify the families and to support their integration when they return back in the country. So this was the first step through a program matching their efforts to big NGOs and trying to have local presence and to support. Later on, step by step, Director was one of the organizations I can call the mother and the daughter, Nisma, because she supported the organizational development, the programmatic and content approach on how to behave, especially on protection, case management and protection fields. So the majority of our content of field work, community work, dissemination of case management processes, working with the child protection system has been for sure a property, or the author has been Director. And year by year we strengthen our efforts in the community. So we have been partners in so many programs, and at the same time partners in advocacy, trying to improve the child protection system in Albania and to behave as one actor behind too many challenges that Albanian children has faced in years. So even when in 2016 we transformed ourselves from a branch of Arsis in Greece to a local NGO, they have been one of the promoters and the ones who supported us in all this transition process, taking us as a consolidated partner in major programs they have been implementing, and for sure in the new one that we are starting together again in a regional level now, not only national level with Director of Albania, but in a regional level. We are very proud of continuing this good tradition of partnering and strengthening each other works in our country.
So you mentioned that you are starting working on a regional program. Could you say a bit more about that?
Yes, this has been a great efforts of a bunch of professional teams for different Director zones in Hungary, in Kosovo, in Romania, in Greece, and in Albania with Nisma Arsis, to join our efforts with the CRV program, that is Citizen Equality Rights and Values program. So it's a huge one funded by European Commission related to mental health support. It's called Unity in Care because it means too much effort from a regional perspective to bring new methodologies on psychosocial well-being and mental health support to children. So it's very concrete. It's related to grassroots work with children, especially vulnerable children, with different methodologies that has been piloted and approved and validated that has been somehow contextualized in each of the countries, and for the first time in Albania. And we are very happy to bring these new methodologies on working on psychosocial and mental health with children, especially with very good lessons learned and perspectives from other countries. So this is a regional approach, but in each country will be disseminated this kind of new way of working with vulnerable groups, especially children in school and the community level, but at the same time with the professionals and stakeholders from public authorities.
And this is only one of your programs. You have a lot of them. You are working in child protection, education, community development, working also with refugee children and their families, and you try to prevent human trafficking as well. And I know it's hard, but could you elaborate a bit on this really complex work that you do.
Everything has been developed step by step. In the beginning, we started working mostly with children in street situation because in Albania was a huge issue. We have a high number of children identified in the streets, and the majority of them ended up as victims of trafficking, victims of domestic violence, neglection and exploitation. So we understood that we need to provide to them a holistic approach. We couldn't take care only of children because they will go back to home and they see another environment. So we try to have an intersectorial approach, so to work with the child, to work with the family, with the community members for prevention, but also with the system, with the public stakeholder who has the main responsibility on the identification, referral, immediate support, and later on rehabilitation and reintegration. So we started mostly with those groups of children and youth who were most at risk. And through our pathway, we understood that we're not only children victims of trafficking or children in street situation, but also there were children without parental care. We were children victims of sexual abuse. There were children in conflict with the law. So we understood that we couldn't take care of only one category and close the eyes with the other one. So step by step, we extended our community work. We had 3 community centers in different areas, mostly suburb areas, peripheral areas, in order to make possible to provide access to dedicated service to these groups. And in 2016, we extended our work to provide a shelter for this group of children for a short period of time until the institutions, child protection institutions, reacted and decided what to do with the child. So the shelter and the community centers are our main programs that makes us somehow visible, present, and engaging for all the people who lack access or they do not get the proper services they need in order to make their support easy. And later on, we understood that we work with children that became youths. That was very difficult to go out from this chain of vulnerability. So for this reason, we understood that we work with children, with youth, because they became adults and they became parents again with the same situation. So this was a cycle. And we lately extended our services not only to case management, immediate support, community services, but to reintegration toward employment, for example. We understood that the parent who cannot work cannot provide well-being to their children. So we try to extend step by step, understanding that the needs should be fulfilled holistically. We cannot support a child in street situation, for example, if the family does not accept that there is a problem and they need to go to parenting classes, to work, to be employed and to generate incomes, to bring the child to school. So it's not an easy process. The reintegration and the rehabilitation process needs too many actors to be engaged, and somehow we make the role of pushing these institutions to take their own responsibility. So in this moment now, we have a wide range of programs who are focused on identification, prevention, and immediate support. In 2020, after the COVID, we have a huge flux of refugees in Albania coming especially from Greece, especially unaccompanied minors who were leaving the camps in Greece, transiting the territory of Albania, intending and expecting to go to other EU countries. But those who were illegally passing and captured by police were identified as victims of trafficking, and the majority of them has been supported by our shelter. And this is how we started engaging in refugees and trying to provide at least immediate support, protection. And in 2021, the Albanian government decided to have Afghan refugees. So we were identified in the child protection system in Albania as one service provider who provides immediate support, emergency, humanitarian one, and especially protection. So for the GBV, gender-based violence components and child protection issues, they selected us to disseminate this information, to make them aware among refugees, and to provide them an open door where they can report and get access to services.
It's really complex, and you cannot treat a child just like an individual. You need to, as you said, have a holistic way. So it's really interesting. The human trafficking component, it's also, for myself, it's a bit terrifying because in my understanding it involves also organized crime. Mm-hmm. What are the challenges in this component?
It's a very good question, and I think it's the most difficult part of the chain of trafficking. Because when we identify children as victims of trafficking, and the majority of our Albanian children trafficked in Albania, so we have less cases of Albanian children in foreign countries or otherwise foreigners trafficked in Albania. Majority of them are children in street situation, in very vulnerable situation, living in poverty, who are trafficked by their parents or other familiar adult people who want to benefit from their income-generating activities in the streets. Selling, criminal networks, so robbing or theft with other networks, distributing substance, drug abuse, so different small crimes, especially children that are under the criminal responsibility. And their age is in that has been somehow tackled by these traffickers as the most potential one, because they can be lied with a sweet, with some pocket money, with small items, so it's easily to engage them. How we make sure that even as we're protected in this chain of criminal network, but also how children can be identified, is that we had a great cooperation with police. If they see a child in police station that has been identified, has the indicators of victims of trafficking, they call us. We are present during the interview. We try to connect with the system and make sure the case management process follows up after the identification. But it's not easy, because if criminal adults are family-based, so are from families, the child needs to be separated from the family, and this is the most difficult part. Because the child goes to an institution, we don't have a foster care system in Albania, so immediately goes to a residential care facility who the family care is lacking, and for us this is the biggest challenge. Secondly is that there are few cases of investigation from police. Because it's a child, it's under criminal responsibility, so it goes again and again in the street in the same situation, so we can do less on that part. We can work with the child, at least with the family, but not with the system. So it's very difficult that the child come back in the same situation. And thirdly, and the most important ones, there are lack of services. Even though we try to provide some support, we cannot substitute the system. We can take care of 5, 6, 7 children based on program-based, on project-based, but there are lack of sustainable services from the local government to engage on proper dedicated services to this group of children. And unfortunately, we see that these children can be recidivists and in the same situation again and again.
What can be done in this kind of situation? You need more organizations like you to help children. You need strengthening the state systems.
Good. Yeah. I think that organizations, civil society sector does a great work, because I think it's the mission inside and the passion on trying to change things in their communities. But it's not enough. This is not the role of the organizations. Somehow the organizations transform their role as actors who want to fulfill the gaps from the authorities, public authorities, and I don't think this is the main role. They should be engaged in advocating, in rights present, in improving, in innovation, but not fulfilling those needs that the central government and the local government should be provided. I think this is engagement for more social care budget and resources from the local authorities to municipalities that can be distributed to the most vulnerable groups. If there is a huge number of children in such situation or in conflict with the law, it's because families are lacking services. They lack support on education, on parenting behaviors or attitudes or skills, economic, so employment, proper employment, and this is why they neglect proper care and support to children.
And to have a bit more optimistic approach, on your website, I read a lot of heartwarming stories about the children you helped with your activities. Can you tell our listeners one success story that pops into your mind and you are really, really proud of?
In the last 4 years, we have been engaged with the Ministry of Health and Social Protection and UNICEF in Albania to transform the residential care institutions into community services. We are against closing children in big residential Eastern model of caring of children. Even we don't have a proper foster care system, we are pushing that municipalities should engage on identifying foster care families. The child needs a family and not an institution. Saying that, in the last year, fortunately, we have reached together with the municipality of Korça and Vlora to close 2 institutions and to support their staff to transform their work into community services. So if a family cannot take care economically or socially of a child, they can have support during the day from the community centers, but in the evening the child sleeps with the mother. So for this, I'm very proud not only of the team, but also of the good cooperation with the authorities that for the first time they engaged themselves to close and to change the mindset from a residential care to proper community and family care. And now we are piloting this model of training the staff, of strengthening the families to reunite with their children into other institutions, in Turas and in Tirana, also a little bit in Shkodra. So it's, I think, a very huge milestone of transmitting from our perspective how important is the family care. A child is happy if he is every day in the morning and sleeping with their families. And if they have social economic issues, it's not the solution to close them, to separate from the families because the family cannot take care of the child and to close institutions. Those money goes to the family and the family can be supported to take care of their own children with incentives, with proper social care, with psychological support, mental health support, everything that is needed that they behave and execute their own parental responsibility. And I'm very proud of saying that because it has been a 5 years efforts at least to change the mindset of the workforce, of the people in the residential care, because they were afraid of they will be without any job in the future. And they were resisting of closing the institution because they were somehow in the position of losing their job, without thinking that the child will not sleep anymore with them, but with their family members. And they can find another job or they can be in a community center and provide services during the day for the family, but not only for the child during the night. So it has been a huge reward on seeing the staff and the state authorities engage in this new mindset.
Yes, no institution can replace a family,
No.
so that's...
Just, I think, I say it loudly everywhere where they say that we have no other option. I say, would you like to be in an institution without a direct connection with a family proper figure? And you will see how difficult it is for a small child, especially from 0 to 5, who are very small, and the importance of the parent is crucial.
Yeah. And to conclude our podcast, let's take a look in the future. What are your plans for the next 5 years?
I would love to see, our plan now is to reach our community services in those municipalities who have not proper social care services. So our intention is to strengthen our department of fundraising and to see how we can reach more children, especially in those rural areas where access to service is limited. Because we have been working in big municipalities with a little bit more facilities and engagement to provide those services, but there are areas in Albania, rural areas, where the most vulnerable groups has not reached out to hear about rights, to hear about proper care services, and especially dedicated or specialized care services. For this reason, our approach is to close more institutions, to provide more dedicated services to children and their families, especially in rural areas.
Okay. Thank you so much, and I wish you all the good luck and all the good health for your work.
Thank you very much for the opportunity. It was a great pleasure to talk to you and to share our experience, and hope that, I think one important milestone of civil society organization is networking and partnering. We cannot do that alone. For this reason, LocalLink Hub, it's one of the best, I think, options to engage and to strengthen these partnerships.
Thank you so much.
Thank you.
I'm Majko Vas, and you've been listening to a LocalLink Hub podcast. Our longtime help with podcast is Judit Németh Almási, Thank you for your dedicated work. Thanks to all of you for listening, and thank you Majko from Nisma Arsis for joining me today on this LocalLink Hub podcast. I hope you all enjoyed this episode, and if you want to learn more about Terre des Hommes initiative, please visit our website locallink.childhub.org. If you have any comments on the episode or want to share your thoughts, contact us via social media on Facebook or LinkedIn, or email us on locallink@childhub.org. Thanks for joining. See you on our next episode.